My son decided to major in math in college. So when he went to the summer orientation, he found the table where the math professor was sitting, and he asked, "What math classes can I take?" And the professor just started laughing. And he said, "I've been sitting here all summer, and you're the first student who has ever asked me that question. All the students ever want to know is, how can I get out of taking math?" I tell that story because it reminds me of something that I see a lot in the world of brain health. There is a question that people ask me all the time, and then there is a question that no one has ever asked me, ever, not once. And yet the answer to the question that no one ever asks is one of the best possible things we can do for brain health. Hi, I'm Tony Deering of GoCogno.com, the website for people with mild cognitive impairment. I'm not a doctor, and I don't pretend to dispense medical advice, and I always make that very clear to people. And yet, they ask me anyway. They want to know, well, what about off-label medications my doctor may be able to prescribe to me? What about Aricept? What about some of these others? They ask me about so-called medical foods that can be taken in tablet form. What they really want to know is, what pill can my doctor give me to make my mind work better? Yet, what no one has ever asked me is, what pill can my doctor stop giving me to make my mind work better? Based on what we know right now, your doctor may actually be able to do you more good by helping get you off a pill you're already taking than to put you on more pills. We've got a drug problem, and one that is reaching epidemic proportions. It's called polypharmacy. Polypharmacy is a term that describes the simultaneous use of multiple drugs by a single patient for one or more conditions. You see the suitcase? I was talking to one of the leading neurologists in America, and he told me that the first time he sees a new patient, either for mild cognitive impairment or for dementia, he tells them to bring in all the medications they're currently taking, including over-the-counter medications, vitamins, and supplements. And he told me that it is very common for people to have so many pill bottles they have to bring them in a suitcase. Last year, I did a piece on the 12 most common causes of mild cognitive impairment other than dementia, and I put this one right at the top of the list. Dr. Penny Dax told me, a lot of people who experience cognitive impairment assume it must be dementia once they get older, and that nothing can be done about it. In some cases, this can be the side effects of drugs they're taking, perhaps for a long time. Taking medication is not bad, and taking multiple medications is not bad, as long as all the medications that you're taking have been reviewed by a medical professional, ideally a gerontologist, to make sure that individually and together, they're all still appropriate for you. Unfortunately, that's often not the case. It may be that a drug prescribed years ago is no longer appropriate for you. Drugs also affect us differently as we age. So a drug you took without any problem when you were younger can start having side effects that impact cognition as you get older. And then there are certain combinations of drugs that are notorious for reacting badly with each other. For that, there's a really helpful resource you should be aware of. It's called the Beers Criteria for Potentially Inappropriate Medication Use in Older Adults. Now, once again, let me say, I am not trying to steer you away from medication. I'm just saying, I always ask both sides of the question. There are things out there that may help you, but there may be something you're on right now that's doing your brain more harm than good. And if you can be weaned off of that safely and gradually under the care of your doctor, it could benefit your cognition. If you want to know more about this, I wrote a lengthy article and there's a link to it below. There's also a link to my article about other causes of MCI, and there's a link to the Beers criteria list. I hope you found this information helpful, and I hope to see you again next week. Until then, as always, be kind to your mind.